If you're struggling with back pain, you may be thinking that cracking your spine or other joints in your body would be a good idea and would provide you with relief. But sadly, that's very rarely, almost never the case. I struggled with chronic back pain for 10 years and I've been back pain free for 2 years. And also, I've cracked pretty much all of my joints since I can remember. Since I was a kid, I started cracking my neck. And then when my back started hurting, I started cracking my spine as well. And then that kind of spread out to all of the other joints in my body. So I'm pretty experienced when it comes to cracking joints. Some people would call me like a crack addict, and it's kind of like a funny label. I have no problem with that. But cracking your joints is something that, even though I personally do it, I probably wouldn't recommend it as a required solution for a healing chronic back pain. The best you can get out of cracking your spine or any other joint in your body for that matter is temporary relief. And this can actually be quite a longer temporary relief. Maybe when you wake up, you notice you're a little bit stiff. Maybe your body is still not like warmed up. And if you have like a few nice cracks here and there, you're gonna find that you're kind of like booting up the system. You're getting ready to start with the day, and your body is starting to like kind of get a little bit more relaxed, but also like a little bit more activated with energy. And this is fine. This is actually a good use case for cracking your joints, especially like your back, and maybe like in the middle, like your joints in the hips. All of that can be really good, especially in the morning or after a prolonged period of sitting or inactivity. But if you struggle with chronic back pain and your back hurts a lot, you will probably notice that no matter how much you crack your back or other related joints, your neck, your hips, anything like that, it doesn't really work in permanently alleviating your back pain. Maybe again, you're gonna get a little bit of temporary relief, but that's gonna be short lasting. So this is why cracking your joints is not really a long-term solution. By the way, if you're already cracking your joints, you probably know what I'm talking about here. So despite what some people on the internet, even like some doctors may say, cracking your joints is pretty much harmless. At least that's been my experience, and I believe currently that's even the consensus among the medical community. So if you're already doing that, I see no harm in using this practice to kind of provide yourself with a little bit of relief when you feel like you need it. But if you're not already cracking your joints, I would actually recommend you try not to start this, because this kind of gets addictive. There's not like harmful effects in doing this, but at the same time, there's not really a lot of benefits in here. Again, like if you kind of get addicted on those like little temporary reliefs that you get from cracking your joints, you're gonna need them more and more, and you're gonna notice that you're kind of cracking your joints pretty much all of the time. That's the case with me, if I'm being honest. I kind of crack pretty much all of the joints that I can crack, and that's almost every one of them, probably like every 10 minutes or so. It's really, it's almost like annoying. It's an annoying habit that if I could, I would probably get rid of it. But it's really difficult at this point. So, maybe there's no way back for me. But if you haven't started cracking your joints, I would actually recommend like don't go down that route. I think you're not really gonna gain a lot. Plus, there's also a little bit of a risk for a small injury. You're probably not gonna really do any harm, like especially like a permanent injury for your body. But maybe you can kind of pull your muscle a little bit. Maybe you can damage some tendon or ligament. So it's best to not get started if you're not doing this already. If you're doing it already, you're probably like some sort of an expert, at least when it comes to your body. You know the movements, you know the maneuvers, so you can maybe have a little bit more control, and maybe you can do it in a pretty harmless way. But again, if you're not doing this already, I would recommend against it. Don't start cracking your joints if you're not doing it already. And also, this is not really gonna help you for chronic back pain, so there's not really a lot of use in here. Now, since we're on the topic of back pain and chronic back pain, one of the most common cracks that you will find is actually like just a regular like, I got one actually. I don't know if you heard it, but you're actually that's probably one of the most basic cracks that you're gonna kind of want to do all of the time. Maybe you're gonna lean against the chair and you're gonna do it that way. That's fine. That can provide you with some relief. I actually do this myself as well. But I would recommend in this case, and this is something that I don't really see a lot of people talking about, if you're doing this particular crack, for example, I think it's really useful to kind of counteract it with the balancing act of that crack. In this case, if you're doing it like, like cracking your spine by kind of tilting the hips forward, the next movement you probably want to do is just like the opposite movement of that. So just kind of like stretch your back in the opposite direction and actually like bend forward and try to touch your toes. Maybe that would be a good counterbalancing act here. Because what you may notice is that, for example, if you do this crack a lot, if you do the fists in your lower back and cracking your spine that way, you're kind of gonna notice that your body is starting to adapt to that crack, and maybe you're even maybe gonna develop some sort of like a mild lordosis, or it's like you're kind of gonna shift your spine permanently forward. You don't want to do that. So anytime you do this, try and do this other like counter measure for actually keeping your body balanced and strong. And actually, if you're cracking one spot or one joint frequently, I would actually probably see that as a weakness. That's probably a spot in your body that where the musculature maybe is weak, maybe the ligaments or the tendons are not really like strong and stable, and you probably want to target that spot or those muscle groups with some form of exercise that's going to specifically strengthen them. What you're going to find after strengthening those muscles and those muscle groups is that you kind of need the cracking of that spot a little bit less. You don't need to crack the spine, for example, a lot. If you maybe do like, if you really strengthen your back, and I'm talking like serious exercises like deadlifts and stuff like that, like even like pull-ups and chin-ups and all of that, if you really like strengthen all of the muscles around your core and your spine, you're gonna notice that you don't really have to rely on cracking so much. And your joints are also gonna stop being so crackable in a way. So if your tissue around the joints is kind of weak in a way, it's probably gonna pop a little bit more. You're gonna hear the sound being a little bit louder. And if you strengthen that area, you're gonna notice that even the performing, like getting the crack, is a little bit difficult. And at the same time, you can't really do it that often. So that's a good sign that you should probably work that area. In fact, that's probably my general recommendation when it comes to these types of procedures. So don't do them if you're not already doing them. If you're already doing them, see them as some form of a red flag. So if you're cracking some joint, some spot, that probably means that you should target that place with exercise. By the way, this is why chiropractic doesn't really work for chronic back pain long term. You may feel a little bit of relief, especially after the session is done, and during like immediately after the cracks and all of the movements, you may feel a little bit of relief. But a few days afterwards, you're probably going to need another adjustments, which is why I don't think chiropractic is a good solution for back pain. A related video for chiropractors and chronic back pain is going to appear above me. You can check it out if you're interested in that topic. But essentially, that's the summary of it. Like, chiropractic doesn't work for chronic back pain for the same reason that cracking your joints doesn't really work for chronic back pain. You're not really solving the root issue here. And I talk a lot about the root causes of chronic back pain in my other videos. I believe a relevant video should appear above me right about now. Definitely check it out, because I think you're gonna start moving in the right directions. Like all of these like cracks and chiropractic, they're somewhat of a temporary solution. They're not really going to help you resolve the chronic back pain for good. And that's possible. I did it, and I think everyone can do it. And when it comes to permanently solving chronic back pain, I have a ton of resources on this topic. Definitely check out my free book. I think it's going to be a really massive resource for you and on your healing journey. Also, I have a course, I have an app, I have a lot of resources that are going to be useful to you. Definitely check them out. The links to all of these are in the pinned comment or the description. And one last thing to end the video on cracking your joints for back pain. Even though I don't recommend starting with this, I myself do this because, well, I've been doing it since forever. And as I mentioned, it may have a little bit of a good relieving effect, which is why I'm going to do a separate video on how to exactly crack all of the joints relevant for back pain and how you should do that safely and effectively. The video is probably going to appear above me right about now. Check it out. I will see you there. And until next time, be brave.